Hello, I'm Dr. Anthony Cave, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist. And every week, at least one or two patients come to my ketamine infusion clinic telling me that they've had a bad experience, not a healing one at all, from another ketamine clinic or another psychedelic experience, and that they felt abandoned because no one ever explained to them what to expect and what happened to them in this experience. And now, despite us having these powerful treatments for their depression or anxiety, PTSD, or chronic pain, they're rightfully afraid of ever trying another experience again. So if you or a loved one has ever felt abandoned as you try to heal from these conditions, please follow these 8 tips so that you can select a ketamine or psychedelic experience that is healing you and not scamming you. After all, remember that the recipe for a medical scam is a potentially powerful treatment in a vulnerable population with out-of-pocket costs. Medicine's greatest secret is our inner healing potential, and it's most powerful under anesthesia, when we let go of the reality we think we know. Ketamine is a powerful medication, but it is not a silver bullet by any means unless it's used in a holistic, integrative model that emphasizes you healing yourself and your self-efficacy instead of repeated boosters for months and years to come. Because let's face it, most patients are going to feel better after their ketamine infusion, but the question is for how long? And I personally believe that the ethical and responsible way to use these psychedelic experiences is to tap into the inner healing potential for persistent changes in ourselves, not in a persistent business model to keep bringing patients back for more ketamine infusions unless it's necessary for that patient. And like everything in medicine, there is a time and a place for more medications, but that should not be our expectations from the get-go. And if you're already watching this, it means that you have the determination and tenacity to heal yourself. So please follow these 8 tips to the end because they're all very important to make sure that you select the right healing treatment for yourself to be able to tap into that deep healing potential that all humans have. Number 1 is candidacy. Not everyone is a candidate for ketamine treatments or other psychedelic therapies. And a lot of time, resource, and energy goes into a truly transformative healing experience. So you want to make sure that you're a candidate for this treatment. You never want to feel like you're being rushed into this, that you're not being given a chance to speak with the clinic or doctor first to make sure that this is the right therapy for you. So it's a red flag if you feel like you're being rushed into this without that opportunity, usually in the form of a free consultation. Number 2 is preparation. And that's because our mindset and expectations before we ever start the journey is a powerful predictor for how effective it's going to be in us healing ourselves. All psychedelics require dedicated preparation time, especially if it's your first experience with a psychedelic. That's the difference between a feel-good experience and a truly therapeutic healing experience, or the risk of a bad outcome. You need to find a clinic where the doctor specifically is asking you about your medical history, your psychological history, what medications you've tried in the past, what's worked, what hasn't worked, have there been adverse childhood experiences, or what else is contributing to how you're feeling today, so that we can use that to inform how the therapy will help heal you moving forward. Intention setting is a powerful part of that preparation, and it should be a red flag if the clinic that you're considering isn't dedicating special time for a holistic consultation to help you prepare for this journey after you've had that free consultation. Number 3 is guiding, and that's because this is a sacred relationship that you're entering. I'm not being woo-woo here. This is being very practical. Just like when a patient is trusting their body to me in the operating room or trusting their body to an emergency room doctor in that vulnerable time in their life, you are trusting yourself, your mind, body, and even your consciousness to your doctor throughout this psychedelic healing journey. And you want to make sure that you're not going to just be left alone and abandoned in some sterile medical room, stuffed away with an IV, just tripping out without having emphasis or being guided so that if something particularly traumatic comes up, like a monster, you're being guided to taking that to a healing place instead of having a bad experience from that. So that guidance is critical to reduce the risks from this therapy and crucial to use it in a therapeutic way, not just a feel-good way, but one that's helping you persistently discover your inner healing potential during and after the infusion is over. So it's a red flag if you're going to be alone and unguided for the majority of your ketamine infusion. Number 4 is expectation. Are you being told right off the bat that you're going to need ketamine boosters in the future? That is dangerous because our expectations, like anything in life or medicine, heavily impacts how the therapy is going to go. Your mindset before you even start is a powerful predictor for how effective that treatment is going to be. And if you are already starting the experience with the expectation that you're going to need more infusions in the future, more external sources of support in the future, you're biasing your mindset to not being able to fully tap into your inner healing potential to heal yourself. So it's a red flag if you hear boosters being thrown around a lot and less emphasis on preparation and integration, that we'll talk about in a moment, as being the long-term source of symptom relief as opposed to boosters. Number 5 is the doctor that you're trusting your mind and body to in the process. Ketamine can be used at low, medium, and high doses. You should check out my other videos where I explain those different doses as you prepare for selecting a clinic. But you need to pick a board-certified anesthesiologist or emergency room doctor who's going to be guiding you in this journey, giving you the right dose of ketamine. Not just a blind protocol dose of ketamine, but rather being comfortable enough with intravenous ketamine to give you the right dose, even if it's low, medium, or high, so that you get the right healing that you need. Not just that protocol, like I said, because all of us are different, and one size does not fit all anywhere in medicine, especially for an experience as deep and as sacred as this one. In addition to picking a doctor who's board certified in anesthesia or emergency room medicine, and that's because those two specialties are the most trained and experienced with using ketamine, you also need to pick a doctor that has the right psychological training to help with the mind healing in this ketamine experience. So you should be looking for a doctor that has fellowship level training in either psychedelic medicine or other mind-body paradigms. You also need to pick a doctor that is comfortable and willing and inviting to collaborate with the rest of the doctors and professionals in your care team. That might be your therapists, your psychiatrist, your primary care doctor, whoever else is involved with your healing, either prescribing other medications or providing therapy to help you make the most of your ketamine experience. Nothing in the body is siloed. Not our hearts, our kidneys, our mind, everything is connected. And your care team needs to all be collaborating together. You can't have your ketamine doctor siloed from your therapist because we all need to be working together to help give you the therapy that you deserve. Remember that we depend on feedback from your other doctors to modify our infusions to help give you that optimal treatment, not just that blind protocol and hoping for the best. You're trusting your mind, body, and even your consciousness to your doctor in this process, so you need to be comfortable and trusting of whoever you select to make sure that they have the right training and that they're collaborating with everyone else. So it's a red flag if your ketamine doctor sounds like they're going to be very siloed and doesn't have the right training to give you that optimal level of care. Number 6 is access to your doctor. Medical abandonment is a huge concern for so many of my patients because they've been challenged with so many adversities and they've been abandoned so many times, often either from medications not working, therapists not working, or therapeutic modalities not working. The last thing you want is to have that repeated as you're going through this healing experience. That's why you should always ask about what level of access you have to your doctors throughout the treatment. Ideally, you don't want to have any hoops to jump through to be able to ask your doctor questions, get the support that you need, or otherwise know that you're connected with them and that you can rely on them for support if anything unusual happens throughout the treatment. So it's a red flag if you feel that the doctor isn't immediately available to you, either through email or text or some other modality, knowing that you have their support throughout the journey. Number 7 is integration, and this is really important because after any ketamine infusion, you will likely feel better. But you need to integrate that experience, literally unpack it, process it, apply it to the greater life that you live in, not just experience that and move on. You want to integrate this with your mind and body and heart, bring them all together so that you can derive healing from this infusion even weeks, months, and years later. That's the right, ethical, and responsible way of doing any psychedelic experience, not just for the feel-good moment at that time of infusion. We believe there's a 24 to 48 hour window when the brain is actively rewiring itself, what we call neurogenesis or neuroplasticity. And that is when you need to be working with your therapist or being given tools to be able to process that infusion experience, to be able to tap into your inner healing potential. So you want to make sure that your ketamine clinic is actively fostering and encouraging a form of integration after your infusion is over, like I said, in that 24 to 48 hour window, so that you get the most benefit out of every infusion. And you want your ketamine doctor to also be communicating with your therapist, if there's a therapist helping you with the integration, to get feedback so that subsequent infusions can be as effective as possible. So it's a red flag if your doctors aren't checking in with you after your infusion, if they're not promoting and supporting you in your integration, because that might just be a setup for you reverting back to your pre-psychedelic state and needing more and more boosters in the future. And number 8, maybe the most important of all, is that you should never be pushed or coerced or feel guilty for starting this experience. One of the most important parts of any psychedelic healing experience is you, the patient, being ready. If you have apprehensions or fears, uncertainties, or doubts, you're going to torpedo your healing potential throughout this, because those all actively undermine your ability to tap in to your inner healing potential. That means that you want to make sure that your doctor in this clinic is actively there to answer your questions, that you're not feeling abandoned, that you're confident, you're certain in what to expect. You are confident in how to deal with a bad experience or a traumatic feeling that might come up during the infusion or after. You need to be ready for this, and nobody can force you to be ready. It's only at the right time, in the right environment, with the right doctor, that you can maximally heal yourself, heal your depression, anxiety, PTSD, or chronic pain. Not when someone else wants you to be ready, either with a sign-on bonus or guilt tripping or anything. You need to be ready. There is no substitute for that. So it's a red flag if you feel like you're being pushed into signing a contract for some sort of bonus when you're not fully ready to start this journey for yourself. Are there other concerning practices you've heard of or experienced yourself in psychedelic environments? Let me know below, and I'll do my best to give you my opinion on what I think is going on. Remember that you have more power to tap into your inner healing potential than you've probably ever been told.